This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today we're going to talk about how to diagnose compartment syndrome. If you like this video, we put out new content weekly, so please like and subscribe. So if you're diagnosing compartment syndrome, hopefully you're in the medical field because this is an orthopedic emergency. So with compartment syndrome, basically the short of it is that something happened to a leg or an arm, blood, usually a break, blood flowed into these compartments which don't expand. The pressure is so high in there that the muscles aren't getting any blood flow and will die unless you release the compartment surgically. So the question is, does somebody have this or do they not? And how do you tell? So classically they'll talk about like the signs of compartment syndrome being like pulseless, like there's no pulse, like pallor, like it's white, and being cold and all sorts of other things like that. It's not a really good way to do it, because if you get to the point where someone has a pulseless white, extremity, meaning no blood flow, like it's already dead and you've already missed it and they're already going to have terrible results. So you want to catch it before that. So how do you know? There's three things I think that will really tell you. The first is the pain level. The pain in compartment syndrome is excruciating. They can't walk. They're essentially writhing in pain. If you have a kid, the kid will be writhing in pain and the parent will be quiet, not making a noise, because they've never seen their kid in this much pain before. So that's the one. It's not something someone can walk around or do something with. It's something that's absolutely incredibly excruciating. So the second thing is pain with passive range of motion. This is a big one. So if they have compartment syndrome in the shin, if you move their toes up and down, meaning you're moving the muscles, it should be excruciating. But if you can move their ankle up and down and move everything like that, then usually it's not compartment syndrome. Another thing you can do is actually touch the compartments and squeeze them. And if the compartments are soft and compressible and they don't have excruciating pain, then that's another way to know whether they have it or they don't. And the last thing to definitively prove, and this needs to be done in an emergency room, is something called a striker needle, where you basically put a big needle into someone's compartment and then you put some fluid in and you see what the pressure is. And if the pressure is high, then you know they have compartment syndrome, and then they can go get compartment release. Again, most common area is in the shin, usually after a tibial break, but you can get it in the hand, the forearm, the thigh, even the gluteal area. So you really need to be on the lookout for it. And again, if you missed it, it's quite devastating because the muscles die and it can lead to amputation or even death if it gets infected and the infection travels. So I hope I was able to answer your questions about how to diagnose compartment syndrome. Again, if you like this video, we put out new content weekly, so please like and subscribe. If you have any questions I didn't answer, feel free to leave them in the comments below, but I can't give you any specific medical advice about your condition or patients you're seeing, because this video and all my videos are for educational purposes only.